Hello, thanks for having a look again. So this is the first talk on when things go wrong with the shoulder. So I'm going to have a very brief talk on rotator cuff injuries. So if you recall from last blog newsletter, I talked about rotator cuff group of muscles. So you've got the muscles like supraspinatus, that one over here that forms a tendon, which inserts onto the big humerus bone, the arm bone, and is responsible for moving your arm up or abduction. So this is one that's frequently injured. So the tendon is a stringy-like structure and attaches from the muscle to the bone. So a lot of force goes through that in the years, and tendon turnover is done by what are called tenocytes. These are small cells, and believe it or not, as you get older, they don't work so efficiently. So if people train the shoulders and use it a lot, lifting things, all the tendons are stronger. But most of us sit behind the computer, and of course tendons become weaker. And as I'm afraid you get older, all it takes sometimes is just to move your arm like this, and you can get these sort of micro tears. And this causes irritation around the tendon, sometimes a bit of inflammation, causes what's called a tendinopathy or degeneration of the tendon. When that happens, you have a condition called impingement, and what that basically means is as you lift your arm up, it gets more and more painful. People tell you like, and it's painful. So it causes restriction, and that's a typical rotator cuff type injury. They're turned into different grades. If there's no movement at all, you try to lift your arm and you can't move it, that is basically a complete rupture of the tendon which needs surgical intervention. Don't even bother having any treatment, that's surgical. But most people luckily don't have that, and they just can't move the arm up, or indeed they move up and it's very painful. Very often people complain of pain at night in bed because during the night time you've got a little bit more swelling in what's called the bursa, that water pocket. And there's irritation in the whole what's called the joint capsule, which is a capsule that hangs around the tendon. It all becomes quite sore because you're not moving, and it often wakes you up. So the other tendons that can be affected are infraspinatus and subscapularis. So these are responsible for external and internal rotation of the arm. In other words, moving your arm that way, that's for external, and this way internal. So these often have to be treated in conjunction, because if they're strengthened or loosened up, it can aid your movement. The whole idea of treatment is that you've got bigger range of movement, because these big rotator cuff muscles hold the humerus, the big arm, into the scapula. It gives it stability. So by eventually strengthening the arm, it gives you more stability. But in the meantime, to help calm it down, this is where things like osteopathy or acupuncture are very helpful, reducing the pain, reducing the inflammation, and just making you feel a bit better so you can start moving the arm. The reason why shoulders are always a pain, and I say this to everyone, is because as tendons, they don't have a good blood supply. So it takes a long time to heal. So very often when something like a rotator cuff injury takes place, it doesn't go overnight, they take time. But usually treatment with osteopathy and acupuncture is very successful. If not, then the next grade up is to sometimes have steroid injections. But if you look at the long-term results between conservative treatment like osteopathy, acupuncture, physiotherapy, and injection therapy, the long-term results are exactly the same. And steroids, long-term, if you have a lot of injections in, they can weaken the structure. So if you can get away without steroids, probably better, although they are useful if nothing else helps. So that's rotator cuff injuries in a nutshell, done quite quickly, but I'm conscious that with videos one wants to keep it as succinct as possible. So that's rotator cuff injuries. Next week, big drum roll, is going to be frozen shoulder, especially as the water should have done this in winter really, with a frozen shoulder be more apt, but it's not related to the temperature, it's just that it is frozen. So Hope that's helped or informed you a bit more about rotator cuff injuries. Any questions, just get hold of me, and hope to see you on the next one. Thanks very much for watching. Bye bye.